my question for Missy was, if somebody comes into the office and there's an option for casting versus surgery, as with the Achilles, would she offer both, or would you just say, in my opinion, I would do surgery, and if you go to so and so if you don't want surgery? Because I think that, like, the Kaisers in Northern California have all switched to non-surgical Achilles repairs. I never did it. I always offered it, and I collected a couple hundred people that went the conservative way, so we casted them for as long as they needed,
Yeah.
and that worked out good. We rehabbed them, and they got better. But we offered both. We always offered both.
Mhm.
Let them help the decision. Let them Google it and get second opinions. So anyway,
Oh,
I
yeah, I offer both. I say, here's your option, surgical repair versus conservative care, and I go through the pros and cons of both. I think that's the best way to practice is you got to give the patient the option. And
yeah.
so I do tend to have more that choose the repair because they want to get active faster. But I do have the ones that are like, I really don't want surgery, and I'm like, all right, so we just go through the casting, or I do a lot of boot with wedges that I'll put actually wedges inside the cam boot so they're able to deal with that versus being stuck in a cast.
Yeah, yeah.
Mm-hmm.
To your point, though, Richard, about going conservatively, if you do go the conservative route, there are so many different ways to modulate tissue now as it's healing. Whether you decide to do orthobiologics or modalities or different things that might not have been available as widespread 30 years ago.
Correct.